If your blood pressure went up on keto, do not blame the diet too fast. Your body may be losing the very minerals that keep pressure stable. You cut carbs. You stopped the sugar. You started keto because you wanted better energy, lower insulin, less belly fat, and maybe even better blood pressure. But now something feels off. Maybe your blood pressure is still high. Maybe it is higher than before. Maybe you are getting headaches, heart pounding, fatigue, dizziness, muscle cramps, or that strange feeling that your body is running on low battery. Here's what's really going on inside your body. Keto changes fluid balance very quickly. When insulin drops, the kidneys start releasing more sodium and water. That is one reason many people lose water weight fast in the beginning. But that same shift can also pull potassium and magnesium into the problem. In other words, the issue is not always that keto is failing. Sometimes the real issue is that your electrolyte strategy is failing. Early keto is well known to increase sodium and water loss, especially in the first few days, and professional reviews now emphasize monitoring sodium, potassium, magnesium, and overall fluid balance during carbohydrate restriction. Let me explain this with a simple analogy. Imagine your blood vessels are part of a home plumbing system. Electrolytes are the pressure regulators, wiring, and signal controllers. If sodium, potassium, and magnesium are out of balance, the system does not run smoothly. Your blood vessels can constrict more easily, your heart rhythm can feel off, and your nervous system may stay more stressed than steady. Potassium intake is strongly linked with healthier blood pressure control, and magnesium also plays a role in blood pressure regulation, though supplement effects are usually modest rather than dramatic. And this matters even more after 50, when blood pressure regulation, kidney reserve, stress hormones, sleep quality, and medication use can all complicate the picture. The good news is this: once you understand the physiology, you can often troubleshoot the problem much more intelligently. We are going to break down why keto can trigger electrolyte losses, why just eat less salt is often too simplistic, how potassium and magnesium fit into the picture, what the research shows, and what simple daily steps may help you stabilize pressure more safely. Current blood pressure guidance still recommends keeping sodium intake below 2,300 millimeters per day, ideally closer to 1,500 millimeters for many adults, while also emphasizing potassium-rich foods for appropriate patients. And if this kind of science-based health content helps you cut through confusion, subscribe now, because I post videos like this regularly to help you understand what your body is actually trying to tell you. 6 science-backed insights we'll cover: why keto makes the kidneys dump sodium and water early on, and why that can change blood pressure fast. Why high blood pressure on keto is not always caused by too much salt, because low potassium and low magnesium can distort vascular tone and nerve signaling. How insulin, cortisol, and dehydration interact, and why stress chemistry can keep blood pressure elevated even when carbs are low. Why some people feel worse when they overdo fasting, coffee, or electrolyte drinks, especially if the balance is off or medications are involved. Which foods and minerals matter most, including practical potassium and magnesium-rich choices that fit a lower carb pattern. What a smarter keto blood pressure protocol looks like, including hydration, symptom tracking, medication caution, and when to talk to your clinician. Important note for safety: anyone with kidney disease, heart disease, or blood pressure medications such as ACE inhibitors, ARBs, potassium-sparing diuretics, or certain heart failure medicines should not blindly supplement potassium, because too much can be dangerous. Here's what's really going on inside your body when you start keto. The moment insulin begins to fall, your kidneys stop holding on to sodium the way they did when carbs were higher. That means you start losing sodium and water more quickly in the urine. This is one reason the scale drops fast in the first few days. But it also means many people mistake a rapid fluid and mineral shift for the diet not working, when in reality, the body is going through a major electrolyte adjustment. Reviews of low carbohydrate and ketogenic diets describe this exact mechanism. Lower insulin reduces kidney sodium reabsorption, which increases sodium and water loss and can change blood pressure early in the process. Let me explain this with a simple analogy. Think of insulin like a hand on a faucet valve inside the kidney. When insulin is high, the body tends to hold on to more sodium. When insulin drops, that valve loosens and more sodium and water flow out. Now here is the part most people miss. Where sodium goes, water follows. And when fluid balance shifts fast, potassium and magnesium problems can become more obvious too, especially if the person is eating fewer mineral-rich foods or already taking blood pressure medication, diuretics, or drinking too much coffee while fasting. So yes, keto often improves blood pressure over time, but in the short term, some people feel worse because the transition phase is unmanaged. They are not necessarily failing keto. They are failing the adaptation phase. That is why the first goal is not just eat fewer carbs. The first goal is to stabilize the terrain. Fluids, sodium, potassium, magnesium, sleep, and stress. Because if the terrain is unstable, the blood vessels, nervous system, and heart all feel it. And that is often the hidden reason blood pressure becomes more unpredictable before it becomes more stable. High blood pressure is often framed as a salt problem, but on keto, that is usually too simple because your blood pressure is not controlled by sodium alone. It is controlled by a team: sodium, potassium, magnesium, kidney signaling, vascular tone, stress hormones, and hydration status. When one player is missing, the whole system becomes less stable. So a person can cut carbs, feel better metabolically, and still struggle with blood pressure if the deeper mineral balance is off. Here's what's really going on inside your body. Sodium helps regulate fluid volume, but potassium helps blood vessels relax and supports healthy blood pressure signaling. Magnesium helps with muscle relaxation, nerve signaling, and vascular function. If sodium is low, you may feel weak, dizzy, or headachy. But if potassium is too low, blood vessels may stay tighter and the heart may feel more irritable. And if magnesium is low, the nervous system may become more stressed, sleep may worsen, cramps may show up, and blood pressure may become harder to regulate. Major heart and blood pressure guidance continues to emphasize potassium-rich eating patterns for blood pressure support, while magnesium is recognized as a meaningful supportive factor, especially in people with low intake. Let me explain this with a simple analogy. Think of sodium as the water level in a swimming pool. Potassium is the drain and flow controller that prevents excess pressure from building where it should not. Magnesium is the quiet technician keeping the pump motor from overheating. If you only think about the water level but ignore the controller and the motor, the whole system becomes erratic. That is exactly what happens when people go on keto and only focus on salt packets or electrolyte powders without looking at the bigger picture. This is where food quality matters. Some keto eaters remove processed carbs, but they also accidentally remove many potassium-rich foods and do not replace them well. They eat more cheese, bacon, coffee, and packaged keto snacks, but not enough avocado, leafy greens, mushrooms, salmon, zucchini, pumpkin seeds, or mineral-rich whole foods. Then they wonder why blood pressure is still unstable. The problem is not always that keto is wrong. The problem is often that the mineral density of the keto diet is too low. What the research shows is that higher dietary potassium is consistently associated with healthier blood pressure regulation, and many adults still do not get enough. So the practical takeaway is this: do not treat electrolytes like a one mineral issue. Think in patterns. Are you hydrated? Are you salting appropriately for your situation? Are you eating potassium-rich whole foods? Are you getting magnesium from food or a well-tolerated supplement if needed? And are you taking medications that change electrolyte handling? If this is helpful so far, consider subscribing. I post content like this regularly to help you understand the root cause, not just chase the symptom. Here's where a lot of people get confused. They think low carb automatically means low stress on the body, but that is not always true during the adaptation phase. If you combine keto with dehydration, too much caffeine, poor sleep, aggressive fasting, and not enough minerals, your body can shift into a stress response instead of a stable fat-burning state. And when that happens, blood pressure can stay elevated even while you are doing everything right on paper. Early keto symptoms like dizziness, headache, fatigue, and lightheadedness are widely reported during initiation and are commonly linked to fluid and electrolyte shifts. Here's what's really going on inside your body. Dehydration makes circulation less efficient, so the cardiovascular system has to work harder to maintain blood flow. The American Heart Association notes that when you are well hydrated, your heart does not have to work as hard to pump blood. At the same time, excess cortisol and sympathetic nervous system activation can tighten blood vessels, raise alertness, and make pressure look less stable. Recent reviews on prolonged fasting report transient endocrine shifts, and some fasting studies show an early rise in sympathetic activation. Other reviews note that longer fasting can elevate cortisol in at least some settings. Let me explain this with a simple analogy. Imagine you are driving a car uphill. Keto can be a better fuel system over time. But if the radiator is low on water, the tires are underinflated, and you are revving the engine with caffeine and sleep deprivation, the car still strains. That is what happens when people stack too many stressors at once. They start keto, skip breakfast, fast too long, drink extra coffee, sleep 5 hours, and then wonder why their blood pressure, palpitations, or anxiety feel worse. The issue may not be ketosis itself. The issue may be that the nervous system is being pushed faster than the body can adapt. So the practical move here is not to panic. It is to reduce load. Hydrate consistently instead of chugging water only when you feel bad. Do not jump into long fasts during the first phase of keto if your blood pressure is already unstable. Be careful with excess caffeine, especially on an empty stomach. Protect sleep like it is part of your blood pressure treatment, because it is. And if you are on blood pressure medication or diuretics, monitor symptoms and readings closely with your clinician, because electrolyte and fluid shifts can change what your body needs. The American Heart Association's 2025 blood pressure guideline emphasizes accurate home monitoring and individualized management, not guesswork. This is where people often make the problem worse without realizing it. They feel weak, lightheaded, headachy, or notice their blood pressure is acting strangely, so they assume the answer is simple. Drink more electrolyte packets, add more salt, fast harder, push through. But the body does not work well with random correction. Electrolytes are not a guessing game. More is not always better. Better is better. Here's what's really going on inside your body. During early keto, sodium and water losses are real, especially in the first few days. But that does not mean every symptom is fixed by pouring in sodium all day long. If you overload sodium while staying low in potassium and magnesium, you may feel puffy, thirsty, or keep blood pressure unstable. On the other hand, if you start throwing potassium powders or salt substitutes into drinks without understanding your kidneys, medications, or lab history, you can create a dangerous situation. The American Heart Association notes that potassium can help support healthy blood pressure, but it is ideally increased through food for most people, and people with kidney disease or certain medications need caution. Let me explain this with a simple analogy. Think of electrolytes like tuning a piano. If one string is too tight, the sound is off. If you tighten every string harder, the piano does not get better, it gets worse. That is what happens when people stack electrolyte drinks, salted coffee, fasting, and stimulant-heavy fat loss habits without balance. The National Kidney Foundation warns that excess potassium can be dangerous, especially when kidney function is reduced. So the smarter move is this. Stop chasing symptoms with extremes. Use a consistent hydration routine. Get most minerals from real food first. Be very careful with potassium supplements or potassium-based salt substitutes if you have kidney issues, or take ACE inhibitors, ARBs, or potassium-sparing diuretics. And do not combine a shaky keto transition with aggressive fasting hacks just because someone online told you more discipline is the answer. If this is helping you think about keto in a smarter way, subscribe now, because I post content like this every day to help you fix the root cause, not just follow trends. Now let's get practical, because this is the part most people actually need. What do you eat? What do you stop doing? And what routine gives your blood pressure the best chance to stabilize while staying on keto? Start with this principle: food first, supplements second, extremes never. If blood pressure is unpredictable on keto, your first move should be to increase the mineral density of your meals, not to blindly chase symptoms with powders and packets. The American Heart Association says potassium helps reduce the effects of sodium and also helps ease tension in blood vessel walls, which is one reason potassium-rich foods support healthier blood pressure for many adults. Magnesium matters too, but official supplement guidance is more measured. Magnesium supports muscle and nerve function, and supplements may lower blood pressure a little, though usually not dramatically. Let me explain this with a simple analogy. Think of your meals like building materials for a house under repair. If all you bring to the job site is sodium, you do not have a complete toolkit. You need the full support crew. On keto, that often means building meals around salmon, sardines, avocado, spinach, mushrooms, zucchini, cucumbers, pumpkin seeds, chia, leafy greens, and mineral-rich whole foods that fit your carb target. The NHLBI specifically recommends increasing potassium through food for adults with high blood pressure who are otherwise healthy. So here is a simple daily protocol. At your first meal, include protein plus one potassium-rich keto food, like eggs with spinach and avocado or salmon with sautéed greens. Midday, hydrate steadily instead of waiting until you feel drained. If you tolerate added salt and your clinician has not told you to restrict it, use it intentionally with meals rather than constantly sipping salty drinks. In the evening, prioritize magnesium-rich foods, better sleep, and lower caffeine late in the day. And most important, monitor your blood pressure at home consistently rather than guessing from symptoms. The 2025 AHA-ACC guideline emphasizes self-measured blood pressure monitoring as part of ongoing management. One more important caution: do not casually use potassium salt substitutes or potassium supplements if you have kidney disease or take medications that raise potassium. Even heart health guidance says to check with your clinician first in those cases. And if this is helping you understand how to make keto actually work with your body instead of against it, subscribe now, because I post content like this every day to help you fix the physiology, not just follow diet trends. The real question is not just, is keto good or bad for blood pressure? The better question is, how is your body responding? Because there is a big difference between normal adaptation and a warning sign. Some fluctuation early on can happen as insulin falls, fluids shift, and electrolytes are rebalanced. But persistent headaches, dizziness when standing, palpitations, unusual weakness, blurry vision, or blood pressure readings that stay too high or drop too low are not signs to ignore. NHS guidance on postural hypotension lists dizziness, lightheadedness, weakness, blurred vision, and fainting as common warning symptoms, and dehydration is one of the recognized triggers. Here's what's really going on inside your body. When keto is helping, you should gradually see more stable energy, fewer swings in cravings, and over time, a calmer blood pressure pattern, not a more chaotic one. When keto is not being managed well, the pattern often looks different. Readings become inconsistent. Symptoms worsen when standing. Fasting feels harder instead of easier, and the body feels more stressed instead of more resilient. Recent keto practice reviews also emphasize that changes in blood pressure, glucose, and medication response may require closer monitoring during ketogenic interventions, especially in people already taking medicines that affect blood pressure or fluid balance. Let me explain this with a simple analogy. Think of your body like an airplane dashboard. One number by itself can mislead you. You do not judge the flight by fuel alone. You look at altitude, engine temperature, airspeed, and warning lights together. Blood pressure works the same way. Do not judge your progress by one random reading when you are stressed, dehydrated, or rushing. Use a validated upper arm monitor. Measure consistently at home and look for trends. The American Heart Association says home monitoring is an important part of hypertension care and recommends an automatic upper arm cuff for better accuracy. So, here is the practical rule. If your home numbers are gradually improving and symptoms are settling, your body may simply be adapting. But if your readings stay very high, you feel faint when standing, or you have red flag symptoms like chest pain, shortness of breath, weakness, vision changes, numbness, or trouble speaking, that is not a push-through-it moment. The American Heart Association's home blood pressure instructions say signs of possible organ damage such as chest pain, shortness of breath, weakness, vision change, numbness, or difficulty speaking need urgent attention. That is how you know whether keto is helping your blood pressure, not by ideology, but by physiology, trends, and symptoms. Here's the truth. Keto is not automatically the problem, and high blood pressure is not always a sign that fat or salt is the enemy. Very often, the real issue is that the body is losing minerals faster than people realize, while stress, dehydration, poor sleep, too much caffeine, and aggressive fasting are quietly pushing the system in the wrong direction. That is why this conversation matters. Because if you only chase the number on the blood pressure monitor, you miss the deeper physiology driving that number in the first place. What we covered today is simple but powerful. When insulin drops on keto, the kidneys release more sodium and water. That can change blood pressure early, sometimes in helpful ways, but sometimes in destabilizing ways if potassium and magnesium are not keeping up. And if you layer that on top of cortisol, low hydration, poor food quality, or medications that affect fluid balance, the body can start sending warning signs. So the goal is not to panic. The goal is to understand what your body is asking for. Here's your challenge. Pick one change today and track it. Maybe that means building a more mineral-dense keto meal. Maybe it means stopping the all-day caffeine and actually hydrating properly. Maybe it means checking your blood pressure the right way at home for the next 7 days instead of guessing based on symptoms. Maybe it means backing off extreme fasting until your body is more stable. Do one thing well and watch how your body responds. Because better blood pressure is not just about the number. It is about better circulation, better energy, clearer thinking, steadier hormones, and a body that feels safer and more resilient as you age. If this video gave you real value, like the video and subscribe.